All right, so let's start with the big story that we're tracking on WION this morning, where the Center for Disease Control and Prevention in the United States has told the country's states to prepare for the distribution of a coronavirus vaccine by the 1st of November. The timeline of the order has raised some serious eyebrows and concerns amongst public health experts. They worry that the vaccine approval would be driven by politics rather than science due to the upcoming presidential election. But the White House has said that the 1st of November release date of the vaccine is not politically motivated.
Note that the FDA, you had Dr. Han who said this, I can assure you 100% that the president has never pressured me to make a decision regarding any regulatory aspect of the FDA's work. He said that just a few months ago. It is absolutely the case. You had Secretary Azar saying this morning about the vaccine, whether it's October 15th or November 1st or November 15th, this is all about saving lives. You've had Dr. Fauci say, we in fact briefed the president today. This was a few weeks ago about this in the Oval Office. I was there for that briefing. And Dr. Fauci said there is no political pressure that I have seen at all to move quickly.
Now, in a letter, CDC's Director Robert Redfield has written, and I quote him here, CDC urgently requests your assistance in expediting applications for these distribution facilities and, if necessary, asks that you consider waiving requirements that would prevent these facilities from becoming fully operational by the 1st of November 2020. He also further mentions that waivers will not compromise the safety and the effectiveness of the vaccine. The CDC has sent 3 planning documents to health departments that are to be used to develop plans for an early vaccine. The documents have urged the health officials to figure out now as to which groups are to be prioritized once the vaccine becomes available. They've also been asked to identify providers who will administer the vaccine, and Senior Vice President at the Association of State and Territorial Health Officials have said that the CDC was offering an aggressive but unnecessary timetable. 3 different potential vaccines are currently in phase 3 trial in the United States, and it remains to be seen as to how quickly they become available and whether the 1st of November deadline, as is being suggested, is politically driven. All right, to give us more insights in terms of the controversy that is playing out in terms of the timelines within which the vaccination would be available in the United States, we're joined in by Jagruti Dave, who's joining us live from Washington, D.C. Now, good evening to you, Jagruti. Give us a sense of what's playing out in the United States on the timelines when the vaccine for the coronavirus will be made available, because 1st of November looks too good to be true and something that appears to be driven more by politics, so that vaccine being available before the elections would actually be a big game changer for Donald Trump.
So this is what the letter for the CDC has sent out, the request to states is asking states to be prepared to distribute a potential vaccine. Now, the timeline of the 1st of November, as you say, has raised eyebrows because it is mere days before the election here in the United States. Now, the Food and Drug Administration has tried to reassure concerns, saying that their decision on whether to approve a vaccine or not will be driven by science and the data and not by politics. But President Trump has has talked about the delivery of a vaccine. He talked about it in his acceptance speech at the Republican National Convention, saying that a vaccine will be available before the end of the year, if not sooner. So these types of comments which he has made, normally a vaccine takes a while, a much longer time to distribute, to develop and distribute. That is what has raised eyebrows, despite reassurances that the decisions will be made by science. It's this drive to get a vaccine through, which some critics of the president say is a drive to boost his ratings in the polls ahead of the election more than anything else. But Operation Warp Speed is part of the federal government's drive to fast track the development and the distribution of a vaccine. This has been one of the federal government's priorities to deal with the coronavirus pandemic, and they're setting a lot of store by Operation Warp warp speed, even though there have been stumbling blocks in terms of distribution and logistics, which they have tried to overcome. And this is part of the drive to make sure that states are prepared, as they say, to distribute a vaccine if one is available by that time.
Absolutely, indeed. And this of course, may become a bit of an issue. Have the Democrats weighed in at all about this letter? Have they said anything at all in terms of, whether the vaccination or becoming available for the coronavirus, is this now being turned into a political issue?
Well, some health experts say that the timeline is too optimistic, that it's not necessarily realistic to expect a vaccine in development so soon, because it does take some time for development to the process to take place. Dr. Anthony Fauci, the US top infectious diseases expert, has said that he's cautiously optimistic that if preliminary data is overwhelmingly positive, that a vaccine could be made available earlier than expected. But at the moment, it's anyone's idea as to when one will be made available. There are vaccines in the phase 3 trial, and that is where they test the efficacy of the vaccine against COVID-19. But it's a positive step, and this process has taken place rather rapidly. But it's still yet not certain whether an effective vaccine can be found. So whilst there is some attempts at optimism from some health experts and other health experts questioning this optimistic timeline as perhaps too fast, it's still anyone's guess as to whether any of these phase 3 trials will yield an effective vaccine.
All right, we'll have to leave there. Thank you very much indeed, Jagriti Dave, for joining us and getting us all those insights.